My name is Villaveces. I'm originally from Colombia. I'm a physician and I work in public health. I am here at the United Nations in New York, invited by Amnesty International to encourage the different nations to pass and to sign and eventually ratify an arms trade treaty. From the perspective of public health, I have worked for 13 years in the issue of violence and injury prevention, and I think it is crucial that this treaty is signed and ratified. The public health approach is a preventative approach, and this treaty has a lot of elements that are in synchrony with that public health approach. We have the capacity, from the public health perspective, to evaluate different interventions for controlling armed violence and to determine whether or not those interventions help. The passing of this treaty is extremely important. Some examples that I'm acquainted with in Colombia include a study that is tracing the origin of weapons that have been involved in events of violence and that have led to deaths. Using data from the National Police of Colombia, specifically in the city of Cali, we found that at least 40% of those firearms were imported. 40% of the events are being used or use weapons that are imported from other countries. Yet we don't know a lot about how those weapons came to our nation and eventually led to these events. Using surveillance systems very commonly implemented in the area of public health, we can study the trends over time, the different populations that are affected, and the places where events occur. And so this treaty would provide a lot of elements to address that gap in information that we currently have, and thus help us close some of those loopholes that exist and aim for a better control of the transfer of arms, of conventional arms, of firearms. In terms of evaluating projects, we have been involved also in the city of Cali using surveillance systems additionally. By a municipal decree, the availability of firearms was restricted, and using public health methodologies, we managed to actually demonstrate, both in the city of Cali and in the city of Bogota, the capital of Colombia, a reduction of 14% in the deaths related to firearms among the population. So we can test a lot of these tools that we have using good information systems. This arms trade treaty would provide us with additional information that could enhance those mechanisms for control and for prevention, and help every country improve their governance and make it a good and responsible tool for governance when applied in a fair manner in every nation. Thank you very much.